Awesome. Good morning. Resume recording. All right. So today, what this is going to look like. So just a reminder, your midterm is on 10/18. We will sign into Zoom at our normal time. Okay, I'm just going to pose a question. This is what I used to do for SJSU. Doing it because I mean, the grades were just quite high. And I'm not saying that anyone was cheating, but like I used to open it up for 24 hours and just let you guys take the midterm. The final, I will definitely watch. And I know we did it for the quiz and I've been starting to do it this way. Does anybody have anything they want to say? Like, oh my God, that would be great to have that 24 hours and we'll just go by integrity, or I know that's a hard question because it's like, hell yeah, I'd like to have 24 hours to take my midterm. And
sorry for interrupting. So I just want to clarify, you're opening the quiz on the 18th and then you're asking if you want us to have it open until like the 19th, the full 24 hours.
So it would open 8 a.m. to 8 a.m. basically.
I personally would prefer that because like on Wednesday we have like our clinicals, we get up in the morning, so it'd give me more time to come home and complete it, kind of thing.
Okay. And I really do not have a problem doing that. For the quizzes, of course, we'll be on here because after the quizzes we have class. It's not, again, like I don't trust you. And then for the final, that one will be proctored by me. But for the midterm, I think I'm doing this for pretty much most of my classes that are except for 2, because they're little cheaters. Or sorry, they will take the advantage of the resources at their fingertips. So we'll plan on that. I will put it in Canvas. It will open at, oh, I love it. It's perfect because 10/18 at 8 a.m. until 10/19 at 9 a.m. Right? Helps remember. I think that's completely fair. And Gia.
I hope this doesn't like mess up the schedule in any way, but some of us were wondering if it'd be possible to have all assignments due on Tuesdays, just so we can kind of keep track of like psych theory assignments due Tuesdays, because we're trying to like organize with all other classes and due dates. I feel like it's kind of tricky when we're like, it's due Friday. No, it's due Monday, you know? Is that possible?
It's I didn't just call you honey, but I put words together. I actually have a student named Honey. That's always awkward when we're in clinical. Honey. But any request that is not outrageous, I have zero issue. And I maybe didn't mention this in the beginning. I just had another one yesterday about, oh my God, we have this huge test coming up in fundamentals. Can you please make the care map due 1 week later? I don't care. That's fine. Can we not have a midterm? Of course not. So I have zero problem with that. And see, because again, in my thinking, I don't know your schedule. I'm thinking, oh, I'll kind of spread it out. Everything, if you notice, is due usually the day before class or the Sunday, because I want to make sure that you prepare. But if Tuesdays are a good day, I mean, I have no problem with that. And it doesn't sound like anybody has any, and this is a discussion. We're all adults, so we can discuss this. So I'm happy to take a look at that, and I can easily do that. That's not a problem at all.
Thank you so much. I really appreciate that.
Perfect. So Tuesday at midnight is a good day for you guys. And that's from ATI to all assignments, basically. Okay. And are you guys feeling overloaded? I feel like you, because you're accelerated, I'm it's a little newer for me. So I'm like, am I giving too much, too little? Does it feel about right? Like, it's not like, oh my God, like, Jesus, woman, like, stop putting all this stuff up. Okay. I know ATI does add to it, but again, you can text or call me if you don't want to say anything on here, or email me. But yes, I will go back and do that after this. Paige, before I say anything, if I don't write this down, it's not going to happen. So let me just make a quick thing for me. I already posted the NCLEX, but I didn't do that part. So post, I can clean this up. Post NCLEX. Okay. Was there anything else I was gonna do? Oh yeah, add a video. Ay, Amanda. Okay, perfect. Paige.
Hi, yeah, I just wanted to clarify the midterm on the 18th. We're showing up to Zoom class. We're going to have normal Zoom class and then take the midterm on our own.
So that is a great question. So anytime we have a midterm or a final, I do not lecture. It's a big day. It's once you're done, I just, in any class I've ever taught, quizzes are a little bit different because they're shorter, but for midterms and finals, there are no lecture afterwards. So you basically will sign, you don't even have to come to class. That is the 18th is a Tuesday, right? Okay.
Yes, yeah.
I did that right. So basically you'll sign on whenever you want there. Thank you so much for mentioning that. So there will be no class. In fact, let me just make a little note, midterm online. Just in case for those who may not, maybe in the restroom right now or something, so they'll be aware. So it'll be open from 8 a.m. again on the 18th until 9 a.m. on the 19th. And I'm not sure if I posted how many questions. I think I said 50. I can't remember for this class. I have to go back and look. I think I said depending on ATI. So I will, as I'm finishing up your review, which again, today is Tuesday, which is SFSU. Is this not hard to say? Is it just me? Okay, thank you. I'm like, every time I say it, I have to like say it in SFSU. So you'll see more things coming and popping up today. So hopefully everything will be where it should be. Perfect. See, this is why I love this part, because we get things answered. Any other questions about, I'm actually going to move Quizlet to, because we're not going to have, so if everyone's okay with it, I was hoping to end just a little bit early today. I normally don't do this for my own personal reasons. I do have a meeting at SJSU that I really want to be a part of, and I think you guys will appreciate it. It has to do with advocacy for, not going to say exactly what, but I'm not okay with something that's happening in my department, and I really want to make sure that I'm there. I'm not going to say it in front of everybody, but I want to meet this woman that's going to be in the meeting, and then I want to talk. My boss is going to meet me after. So not that we're going to end super early, but we're going to end a little early today, but we're still doing everything. I just moved one thing to the bottom, which is a review, which is fine because we'll do Quizlet 2 will be on depression and anxiety. And this is what I like to call in-class study time. I like to do this about every 4 to 6 weeks, where we just take a minute and do an in-class review of study. And we are now at the point where I'm not gonna, well, yes, I will potentially call on you, but I go down the line. And if you don't know it, it's okay. You say pass, just say pass. No harm, no foul. You probably knew every other single question I asked, but that one that you got, your mind went blank. So today is on schizophrenia. I believe I have 25. So not everyone's going to be called on. I will completely randomize it. Like I'll go, like, for instance, Paige is number 1. I'll skip Paige, go down to number 3, which would be Paulina. This will all change by the time we do it. And then I'll go down by 3s or something like that. That way it's fair. Okay. Paige is like, yes, I'm going to keep talking. So if I talk, that means I'm on top. All right. So today, basically how it's going to look is we did our check-in for ATI, which I think is great. You guys got your questions answered. I think we're all on the same page. If we're not, and you have more questions, you can always reach out. Please, also, I wanted to mention, I don't check my SJSU, and I have not opened an SFSU email yet, and I should. If I don't get back to you, it's not because I am quick. Like if you've ever emailed me on Canvas, like I'm very quick. Please text me. I'm not ignoring you. I don't really get that many emails on my SJSU. So that's kind of the last one I check. And I don't ever want you to feel like you're being neglected, or if you need like something quick, don't sit there in agony. Alyssa?
Yeah, I just wanted to ask, would you prefer us to contact you via Canvas inbox?
To be completely honest, and this school doesn't have a thing against it. I personally prefer text if you're comfortable with that, just because if it's something quick, if it's something like I can't come to class, I mean, things like that, I don't mind. Canvas. Oh, that's smart. I see what you're saying because I'll see it. So yeah, I actually do. That would be really good. So if you are going to email me, if you could email me through Canvas, I think that would be more efficient. If it's something that's really, really quick, like, dude, you forgot to like, don't say, I mean, well, you could say, dude, but like you forgot to put a Dropbox, please text me so that I can immediately go in and add the Dropbox. But if you don't feel comfortable texting, then that's fine. I know a lot of instructors don't do that. I much more prefer that because then, you know, Paige, Paulina, Emmy Lou, Gia, you know, Austin, all of you guys aren't going to be potentially seeing it and then get super anxious about, oh my God, it's not there. And then I can just fix it. Less stress is best. We have enough, all of us. I can't believe how you guys are even like, and you all come to class, like seriously. I love it. Thank you. Online is not always that way. Actually, I've been pretty lucky, but still, I appreciate it. So yes, please, that's a great idea. So Canvas best or text. And all right, so we've done ATI, we went over questions. I will change things to everything down here that I said I would change. I'm not going to post this because it doesn't have actual information. I will post the RN questions. These are random. I just thought it'd be fun to throw in some like random med surg ones. Why not? And I know that you guys seem to, I love the NCLEX questions. So what we're going to do today, right now it is 9:50. Jesus, my God. It's 9:51. Time flies over here. I know that some of you may be thinking like, why do we have to watch this movie? Is it relevant? I like the why. And I don't know if your nursing instructors have taught you about ask why. So what are the whys? Why are we doing this? Because if we understand why we're doing something, especially in nursing, if you're, why do we hang a piggyback? What is what? I mean, I know you probably know why, but knowing the why behind things really helps you understand what you're doing, why you're doing it, and making all the connections together. For Call Me Crazy, I know we've kind of done it in chunks. And from my recollection, we did the first one with Lucy with schizophrenia. We've done the second one, which is bipolar. We've done the fourth one, which is depression. And we have not done the third one, which is more about the family dynamics. And it kind of sneaks in one of the other characters, which you'll see. And then the PTSD one. The reason why is because I do not have you in clinical. I know not all of these go directly with what we may be talking about on that day, but not will they only help you in clinical, but you'll see things that you'll be shocked about or maybe not understand. That's why I'm doing it. I'm not trying to just waste time. I mean, I just am that in I just feel that video is just so well-rounded, especially if you are in mental health right now. I feel like you'll connect with it potentially a little, not, well, that's not a very good statement. I think a lot of you will connect with it and it will help you just all the way around. So that's why I want to watch it. And I don't want to keep pushing it off. That's why I put it first, because I really want you to see it so you don't forget, because it does kind of have a vignette that it circles around at the end. And I don't want you to forget the key players. So that's why we're watching it. We're not just watching it for fun. It really is. There's a purpose. Then we'll do our Quizlet review, the random NCLEX questions. And then the ATI, well, we already did that. And then just a reminder, bipolar we're doing next week. However, it will not be on your midterm. And we will do the ATI anxiety done in class. We should have no problem finishing all of this today within the amount of time that we want to finish it. So are you guys ready? We'll start with the movie. We'll finish it. And funny enough, just remember how I said last time you all went on, you took off your camera. I showed this on Zoom to another class for clinical because we didn't finish it and they did the same thing. So I understand that I show my face so you know I don't leave. If you don't want to show your face, it's not fine, but please, please, please watch it. I trust that you're going to watch it. Okay, please. Promise? Okay. All right. So we'll get that done first. And I already have it set up. So let me put this little guy away here and we'll share. Perfect. New share. All right. So it's just 2 vignettes. It should take 35 minutes. And then we'll take a short, I have to go to the bathroom break. Not me, but like you guys. Or me at the time. Okay, do you see Call Me Crazy? Okay, perfect. We'll open it up. And then Paige, if you'd be so kind to give me a thumbs up when you hear noise, that would be great. Or if you hear noise. If you don't, go like this. So I'm gonna press play.
I'm still seeing the Word document.
Oh, okay. Thank you.
I don't know if that's just me.
I will put it away. Oh, no, you're right. No, it's green. You're right. And I see some, oh, everyone's chatting. Same. Okay. You guys are so funny. All right. Get rid of it. Go away. All right. Now let's try this. I don't want to resume you. I want to share you. Thank you. So stop the share. Perfect. There we go. And we'll share. We're going to do this one. Perfect. All right, I'm going to stop the recording. Yeah, that's a heavy one, right? And I find it, I mean, all of them I think are important vignettes, and I think that some of us have seen PTSD, we've seen it in different ways, and I do like that they used the example they used. And this is not saying anything bad about them. That's not what this conversation's about. It's more about the symptomology and kind of what happened. So of course she came home, she was overwhelmed and delighted because she got to see her son and her family. And it was very, in my viewing of I've seen this, God, I can't even tell you how many times. I still enjoy it every time I watch it, because I feel like you may be seeing something that you haven't seen before. And I feel like I always see something different or from a different viewpoint. And then I hear something from you guys that clicks. So before I say anything, does anyone just have any general kind of either question or something that they saw specific with anxiety disorder, PTSD? I'll just throw, I mean, we saw nightmares. We saw a very patriotic, what is it called? The patriarch of the family, of being the father, and he was in the military, and you know, all of that. So I'm going to open it up to you guys. What did you see?
I mean, what stuck out at me is kind of just the association of PTSD as, oh, it's combat related, and not necessarily recognizing that it could occur from other traumatic events, and that's just as valid and important. And just also, I mean, I'm not from the military, but I have friends in it, and just things I've heard of just the culture in the military and how that's not necessarily conducive to mental health related things.
Absolutely.
Sorry.
No. I'm not saying everybody needs to cry or have the same feelings, but when I see it, this is again one reason why I showed this specific video, because I'm not trying to make you all sad. I'm trying to, you know, and while I was watching it, number one, what you said was so something that I was hoping someone else would say, but that's so true. And it doesn't have to be military sexual trauma. It could just be, one moment, sorry, one moment. I'm so, so very, very sorry. Apparently they're changing my door locks today. And I said, no, you're not. We're in class and go away. So my apologies for, that was like the worst timing ever. So I think we're going back. Thank you, Paulina, for being vulnerable. I know that's not always easy. I don't know if you could tell, and I tried really hard, but I teared up as well. But we were talking about how something so important, because I do think we kind of sometimes, and I'm talking from my own experience, I've seen this more times than I would like to even have to say, but I mean, at least 100 times. I don't strictly deal with PTSD, and we all have our specialty within mental health. However, that doesn't mean it doesn't come up, and it can come up from military, it can come up from all sorts of trauma. It's trauma related. And I just want to really hone in on that part where Paulina said, and I'm sure some other of you were thinking the same thing, which is it's not always combat related. It doesn't have to be sexually as well. It could be, I mean, just being there and seeing what you're seeing, right? And I don't want to hone in too much on the military, just because I know everyone has their own opinions on that, and that's not really, what we're here for. But yes, I'm going to leave it at that. Besides the video, I'm just curious, can anybody, and maybe someone that hasn't said a whole lot, and I don't want to call on you guys, I hate doing that, but it's typically tends to be the same kind of like 6 to 7 people who are a little bit more interactive. Not saying that you're doing anything wrong, because I have not made that happen. Please be quiet, not you guys. Shh, please. Of course, the one day that they're doing the doors. But can anybody think of another reason why PTSD might happen? Somebody that hasn't really maybe spoken. It doesn't have to be a private reason. It could be something that you've seen or can think of that might cause PTSD. Oh, I'm not muted, right?
No.
Okay. Is that Alyssa?
Yes.
Okay. Yeah, please.
I like being in car accidents, or a lot of people after an accident, they have like, I mean, from my experience, even driving through a red, like an intersection, because I was in an accident where I was going through an intersection and the guy ran the red light and T-boned me. But even now, that happened like 5 years ago, but even now I get so like nervous. Like I know the light is green, but I know a few other, like my coworkers have the same experience where they were in a car accident, but they still have that feeling of a little bit of anxiety when they're driving. Yeah.
I'm so glad that you brought, I'm sorry that happened to you, but I'm so glad that you brought that up, because we go back to talking about somatic feelings, right? Psychosomatic. And we're triggered by, I'm going to shut my door. I'm so sorry, you guys. Ow. And I just hit my hip. I'm going to have a huge bruise. One more. I think I mentioned this last time. I don't know what it is about being a lady, but we are walking Roombas. We just run into everything. That's going to be a big one. Ow. So, yes, I mean, that psychosomatic. So what is it? It's something that has happened. So the psych part, because you remember what happened, and memory happens where? In your hippocampus, right? And then unfortunately what happens, and you guys will learn more about this when we talk about addiction, and then you have your amygdala. So, what Alyssa was just talking about, it's the feeling. So you remember the trauma, then you have the feeling of the trauma. So from what Alyssa was talking about, like being in a car accident, and from what I can tell, I don't know how hurt you were, even if you didn't have a scratch on you, I don't care. You can still have I mean, that's traumatic. That's terrifying. And
it was like the most calmest car accident, but it was just seeing him and then feeling my car getting pushed across. Like everyone was safe, but it was very scary.
And you bring up a good, well, you didn't say it, but you triggered me to think of something. We're all going to handle things differently. So maybe that would have happened to me, and I'd be like, first of all, I would probably be a mess. But it could happen to somebody else, and it could be like, okay, no, that was fine, no big deal. So it's everything, as I mentioned before, is going to affect people differently. But I really like that example, just to remember that, and this is, again, my opinion, not an evidence-based practice, but from my experience, PTSD seems to be kind of underrated, just from what I've seen. And because when we think about trauma, the combat related stuff and this and that, and amputations, which these are all traumatic, rape, molestation, sexual trauma, basically, being beaten as a child. I mean, all of these things. But it doesn't have to be something as, I don't want to say big or as traumatic, because your trauma is different than mine. Again, what I feel is going to be different from what you feel. Being bullied as a child, that can relate to PTSD, right? Do we not remember that? And then maybe we end up in college and you're feeling a little bit kind of that same feeling, and you're feeling the same anxiety because you have those feelings still in your body. So what you just said, I'm going to just guess sometimes when you're going through that intersection, you're going to maybe feel those somatic feelings of kind of like your gut might flip a little and get a little bit sweaty, right? That's a perfect connection. You literally that just made it, you made the perfect round. I almost said roundabout, but I'm like, wait, that's driving. I'm not going to say that. But I do appreciate you sharing your real life experience. I think that's very helpful. And that was actually the perfect example. Does anybody have anything else that they want to mention about what they maybe have seen on camera, or just anything in general before we take a little bit of a break? I hope you enjoyed it, or not. Yes, I hope you enjoyed it, and I hope that you really did get something from it. That is the purpose. And you can utilize this in your further practice. And I promise you, you will see things and go, ah, I get it now. Or I remember seeing that and having the conversation. And I don't know, this is just a movie is very dear to my heart, because I have worked with so many of these cases, and I've seen them and worked with them and cried with them and worked with them and seen people get better. People can get better. Did you guys notice her boyfriend was sitting in the back that she met in the mental health unit? I thought that was a nice little touch too. So, okay, so why don't we, it's 11 right now. Let's take 10 and then we'll come back. We'll do the ATI, whatever that thing's called. We'll do the Quizlet real quick and then we'll be done. We may not end early. We'll end right at 11:45. That's when my meeting starts anyway. And you guys are more important than that. So if I'm late, I'm late. I don't care. I want you guys to get everything you need, and I'm going to make that stop happening. All that barking. So go enjoy 10 minutes, come back at 10 or 11:10. Okay, awesome. Thank you so much. Get started. I already have the video pulled up for the ATI. So again, this is something that we're going to do an ATI together. It still counts as an assignment. However, you don't have to do it alone. You're going to do it group. If you haven't noticed or heard the dings and the dings, I've already gone into Canvas and changed the dates to everything that I've seen so far. And I'll go back through to have things due on Tuesdays at midnight, and added in the NCLEX question. If we don't get to it, it's random, but I think we're going to get to it. And there are more med surge questions. I just, have some fun. Okay. So let's see here. We're going to do this. And this is a pretty quick, if you will. Do you guys see the participants in our ATI? So this is a scenario, and we're going to go through the scenario, and it has a couple questions as well. So we're kind of wrapping up anxiety, if you will. I know I said I was going to do an activity, but instead I chose this because you're paying for it and it's an activity. So we have in this scenario, an individual who has an anxiety disorder, oh my goodness, disorder, and is a 22-year-old female who has an anxiety disorder. Okay. Does it say recording? I can't see from this view. Thank you very much. Okay. So these are our key players here. As we can see, the nurse, the physician, the client, and the assistive personnel. And we will go through it together and in brevity kind of just explain like, ooh, maybe I would have done this different or that different. And you'll get to learn different types of screening tools as well while we're here. All right, let's go.
Hi, this is Mike Shaw. I'm the RN from the emergency department caring for Natasha Simpson. I'm calling to give report.
Hello, Mike. This is Tara Green. I'm the RN who will be caring for Natasha, and I am ready for report.
Okay, Natasha Simpson came in with shortness of breath, chest pain, headache, and she keeps saying that she feels like she's going to die. I'm unable to obtain a health history, and when I ask her a question, she's unable to concentrate on what I'm asking. Her vital signs are blood pressure, 148/76, heart rate is 115, respiratory rate is 32, oxygen saturation is 96% on room air, and temperature is 98.6 degrees Fahrenheit. Also, an electrocardiogram, chest x-ray, and blood specimen have been completed. Dr. Black is admitting her now for observation, and the plan of care is in the computer. Do you have any questions?
No, thank you. Her room assignment is 134.
Okay, we're transferring her now.
Great, thanks.
Okay, so I'm going to stop it right there real quick and just point out a couple things. And I'll do some talking and then I'll ask some questions as we go through. The first thing is the vital signs. We noticed that they're elevated. 115, I believe they said was the heart rate. We had an elevated blood pressure. Usually when somebody is having a panic attack, this is of course very natural because they're having shortness of breath, having trouble breathing. I kind of just gave it away. This person is having a panic attack. So it's under the umbrella, of course, of anxiety disorders. If you've never seen one, had one, it feels a lot like what could you possibly mistake it for? A heart attack.
Heart attack?
I can read Abigail's lips. I see your cat too. So cute. Yes, exactly. Something with your cardiac system and a pulmonary embolism actually as well. So something in that region. So we need to rule it out because remember, what is the most important is safety. So a panic attack has to do with safety too, because our patient's not comfortable and could potentially hurt themselves or harm themselves. But they ordered certain, let's get blood work done, let's get some scans done, let's get other tests done so that we can rule it out to hopefully be able to help this patient and alleviate the symptoms that they're having or catch something that could be deadly, right? Okay, so, and they mentioned they're having trouble speaking with the patient. That's very common because you're having trouble breathing, right? And we will now see what happens with this client.
Help me, I can't breathe.
I'm trying. Now tell me your name and date of birth.
Natasha Simpson, 325, and I'm 22 years old.
Okay. So from that very small piece, I know, Paulina, I know. Especially, so I'm not laughing at the client. It's ATA is great, but there are some that I like to use because it's like absurd in the way and like, hello. So now I'm going to ask you guys. So we're seeing certain things. First and foremost, if you do remember the de-escalation video that we watched in the very, very beginning about like you're in a safe place and kind of setting the tone. I know we need to know your date of birth. I know I need to make sure you're the right patient. I mean, that is all important, but setting the scene, especially, well, in any setting, but with this person having a panic attack, who's having trouble breathing, imagine anxiety times 100, right? I mean, you're not in a good place. Mentally, you're foggy, you're tunneling, you can't maybe see correctly. Your brain is just mush at that point, usually. So can somebody tell me potentially what they saw that was kind of uncomfortable for them just in this part? And there is more to come. Paulina's got her face on. I'm like,
It was just the fact that she's trying, like the person's obviously in distress and having difficulty breathing. I think you would want to try to help the patient address that before you're getting the name and date of birth, even though that is important, but it's kind of breathing's a lot more important, I think.
I 100% agree. You're not about to give her medication or something right in that moment, but then we would of course need to make sure that allergies and all of that stuff, but kind of setting that scene of, I just want to look in the chat real quick so that I don't miss anything. I'm trying. Yes. And in my opinion, and please, tell me what you think. and it gets, as I said, it just gets better. I believe walking in the room, and if I saw that instead of, it was very task oriented. That's what I see. It's very task oriented. We need this information instead of, I see you're having trouble breathing. I'm here to help you. In order to help you, I just need a little bit of information, and I want to get you to where that you feel comfortable. Does that sound good to you? I mean, that could be one way. That doesn't have to be the only way, but that's something that I would probably just like off the top of my head say, so that patient knows I'm there for that reason, not, hey, what's your name, and grilling them with questions. Okay, here we go. Maybe. Oh, now we get to answer a question. So the priority action the nurse should take when using the airway breathing. Oh, I did this with my class yesterday. I'm using mine. So we already get the answers, but that's okay. With airway breathing circulation, our ABC's approach to the client is to assess respiratory status of a client who is experiencing shortness of breath. So the question was basically, what is your priority in this moment? And we always want to assess first. We've talked about that with the nursing process, right? So evaluate for medication, check blood pressure, assess for respiratory status, and encouraging to take deep breaths. At this moment, we notice the respiratory status, and that is assessing. Do you see the word assess? So that's going to be the correct answer. I didn't think about this, but that's fine. This is still useful. But I do want to mention something, and this has to do with your NCLEX. My first inclination, because I've done this for the length that I've done it, is I'm thinking Ativan. I want to see Ativan in that body to rule out like what's going on and to help the patient calm down so that I can help alleviate those symptoms. Not right or wrong. So that's why it's so important for me. If I'm an LVN and that's what I've been doing for, a long time and I'm in the field, to take that out of my head, because just because that's what I might do if I'm at work doesn't mean that's what I'm going to do. Oh, you guys aren't nurses yet, right? But still, you may work in a hospital or have relatives. Sorry, I was thinking of LVN to RN, but still, this is relevant to always think about it as taking your own experience out of it. And so I would have evaluated for medication at the same time as the respiratory, because you can do two things at once. But if you can only pick one, don't you all agree that assessing the respiratory status, and breathing would be the correct answer? Let's watch this lady do her thing.
Miss Simpson, now that I've assessed your respiratory status, I'd like to get a bit more information from you about your health history. Are you able to focus on my questions right now?
What do you want to know?
How are you feeling right now?
How do you think she's feeling right now? Irritated? Right? Irritable for sure. And I understand health history is important, but again, priority. What is the priority? Let the patient know she's safe. I'm going to help you. Right? That's anything else I want to add. This is pretty short, by the way. I know that wasn't much to it, but you can all see why I'm showing this, to kind of see certain things that we may want to do differently. All right, here we go. So our next question is, and I'll tell you what the other ones stand for. So the nurse is basically, they want to assess for anxiety. If my patient, first of all, in this moment, I'm not going to if somebody's in this much distress, it's kind of like if a patient comes out of surgery and they're just got out of surgery, are you going to teach them their at-home care in that moment? Or when they're at a 8 out of 10 pain and half sedated? It's kind of the same thing. If my patient's having an anxiety panic attack, I'm not going to sit there and give them here, can you fill out this Hamilton A assessment for me? It's not the right time. Doesn't mean you shouldn't do it, but it's not the right time in that moment. So the Hamilton, there's different scales for different things. Hamilton A scale does help us it gives us numbers, and it will help us determine have my own kind of issue with scales, but that's not what I'm here for. I'm here just to teach about it, that it does exist. I will not quiz you on any of this or test you on it. The CAGE one has to do with if you potentially have a problem with alcohol. And then SAD has to do with depression. Mass G, I'm almost positive it has to do with mood disorder, but I'm not sure because we don't use it. We use the Beck one. So if you're really interested, please look it up. But that's the one I'm pretty sure it's mood disorder. All right. And I think, oh, this is a good, look at her face.
Miss Simpson, how many hours of uninterrupted sleep do you get each night?
I don't know, a couple. What does this have to do with my pain?
Well, a lack of sleep can make you more anxious, and anxiety can cause chest pain. Have you had any trouble eating, or have you had abdominal pain in the past 2 days?
I haven't felt like eating and my stomach has been hurting.
Miss Simpson, I want to help you with your anxiety.
Yes, I'd like to feel better.
Okay. Wonderful that she said that at the end. Wish that would have happened in the beginning. It's relative, would you all agree with me? It's relative to ask about your sleep because the nurse is absolutely right. But again, in that moment, do you think it was appropriate to ask it in that moment? I think we should ask it, but in that moment, what is our priority? Let's get her calmed down so that she doesn't have, she's having chest pain. Many times when you have a panic attack, you feel impending doom and you feel like you're having a heart attack. And it's awful. I don't know if any of you have had it. And you can actually, as a side note, have a panic attack and actually feel like you feel fine, which almost makes it more scary. And you're like, oh my God, I'm having a really bad chest pain. I'm just sharing. I was 31. So it wasn't that long. Oh God, it wasn't that long ago, but I had chest pain, but I felt fine, but I had a lot of stress going on in my life. And, of course, drove myself to the hospital because that's what we're supposed to do. Don't do that. Because I was lightheaded, but we're nurses or we're, whatever we are, we're healthcare professionals. We can do everything. Long story short, got there. They thought I was having a PE because my enzymes for having a pulmonary embolism were elevated. They did a contrast CT. It took them all of this time. I did not have an IV in my arm for probably an hour and 45 minutes. And I was literally gasping for air. And it took about 2.5 hours to get Ativan in that IV. As soon as they got Ativan in that IV, and that was after the scan, immediately felt better. We just ruled everything out, potentially. And then of course we got the scans back and it showed everything was good. So just wanted to kind of share a personal story with that. Like, just, I hate to see people suffer, especially when they don't have to, right? Like, do our best. I know we're short-staffed. I know that, but okay. It's coming close to an end. So she had mentioned, I'm basically, she wants to help you. So now she's kind of coming back to that. Did you guys also notice that she was standing above the patient? I would have sat down. And did you also notice that she had an assistant personnel in the room? Kind of as, it almost felt like she was a specimen, like the patient. So for me personally, I would go in the room alone unless the person was violent and I felt that I needed somebody there. So that's, all of these things are really important to point out and hopefully will help you in your future endeavors in any part of medicine you go into. Okay. Okay. Love it. So now basically once we know that what's happening to this patient, what are we going to do? What is the most important thing to do next? Okay, is she in any way any way where she's going to be able to take in relaxation techniques at this time? Let's do deep breathing. No, absolutely not. But it's great afterwards. That would be great to initiate psychotherapy at that point. Again, same thing. It's like me not feeding you for 5 days and saying, hey, come here, I'm going to teach you, I always say this, how to change a tire, even though I don't know how. I probably should. I'm not proud of that. But this is not the right time, but I would suggest it, right? So they're kind of trying to trick you. So this is what they'll do on your board exam. Reinitiate daily dose of Paxil. So Paxil we know is an antidepressant, and it's considered an SSRI. It's great, but how long does it take to work? It's not immediate. 3 to 6 weeks, right? Or 2 to 6, depending on what book you read. But what is going to work the quickest? An anti-anxiety benzo, right? Ativan, if you guys, and I know you listened to the voiceover PowerPoint, I'm sorry, I know it was so super fast. We already did that with you guys, huh? With the meds. Did we finish the meds? We went over the benzos. Yeah, we did. We went over the benzos, right? Okay, thank you. So what would be the best thing? Ativan. It's going to kick in quick. If we gave her Paxil, is that going to do anything? Because that's for generalized anxiety. She's having a panic attack. All right, perfect. Almost done with this. Perfect timing too.
Miss Amanda.
Oh my God, that scared.
Tara, I was wondering.
Sorry. That scared me because I thought the video was talking to me. I was like, who I am. Yes.
I was wondering, so in a real life situation, for this person, would you you would want some sort of verbal affirmation or confirmation of anxious feelings, and then you would talk to the provider about the symptoms that she's presenting and ask if Ativan is recommended?
Yeah, so just like SBAR. So you're basically,
Okay.
I think that's Christy, is it? I'm trying to find you.
Yes, yeah.
It's a green box. That's absolutely correct. So SBAR is everything. So it's a little bit quicker depending on how urgent the situation is, but we want to give that information and then we'll give a recommendation. And because you are the nurse and you're going to be, all of you are going to be, probably shouldn't say this on camera, geniuses, but really you're going to be excellent. You're going to know, you're going to give that recommendation. And if the physician, MP, whomever says, no, I'd rather give them whatever it is, or they may just choose something else, but more than likely, this is a very common course of treatment. So that's why you guys are so important. You are the front line. We are so important. Don't ever forget that. I mean, everybody's important, but you're going to be that one to say, hey, I'm seeing this. This is happening. This is what I'm recommending. Did that answer your question, Christy?
I guess I didn't word it, or wasn't clear in my head, but now it is. So I guess in her situation, you want to limit how many questions that you're asking her before giving her relief through the medication. And so would you ask how are you feel, how are you feeling, then what sort of medications is she taking, if any of them are contraindicated against Ativan? I guess how many questions are we asking before giving the Ativan?
It would depend on several factors, but I will give you kind of honing in on this one. For me, I find it very important, and I've dealt with a lot of students that this happens to. A loved one passes away while they're in class. And I mean, this happens, so many unfortunate things happen. And I don't know, and like this patient, I wouldn't know this patient either. So I don't know how they've handled stress in the past. And we do want to limit what we ask the patient, and we don't want to interrogate them or make them feel like they're being interrogated, but we want to make them feel safe. So I hate it depends, but I would say one of the most important things is to validate the patient, and to validate that it appears that you're having trouble breathing, that you're having a panic attack. Has this happened before? If I can get some information, I'm going to be better off to help you. So if I can get just a little bit of information, and then we'll continue on and get you to where you're in much more comfort. That's usually what I would say, because I'm reassuring them that I am on the ball. I'm not just asking about their sleep, because you saw her. She's like, why are you asking me about my sleep? Because it's so far from that moment of what the priority is. And then I would ask them, has this ever happened before? Okay, and what have you taken a medication that has helped in the past? And that's usually where I go. And then from there, then I make a decision. And then I would ask them, this is the last thing I want to ask you. Are you on any other medications? I just want to make sure that I don't recommend anything to the physician that might harm you. And that, in my experience, it makes the patient feel like you're on it and you're not just there to do your job, like just be a task-oriented nurse. You're actually trying to get to the root of the problem to help the patient.
Got it. Okay. Thank you.
You're very welcome. And there's no, I'm sorry, one of the best feelings ever. Once that goes away, it just feels so good to see that you played a part in that.
If I could get an update on Miss Simpson.
Yeah.
Well, she's still anxious, so I was going to call her provider. Before you call, please make sure your client information is in the SBAR format.
Okay, so that's fine that the picture didn't show. Basically, she's talking to her manager and letting her know what's going on and what medications were prescribed. And we don't need to go over this. You saw what I wrote yesterday. I just kind of typed it in. Not that I'm trying to skip SBAR, but for time purposes, we will. I know you all know what it is, but down here, you all know what it is, right? Please tell me yes. Okay. I'm like, please, God. Okay. So the recommendation from the nurses, I'm calling to request a prescription for lorazepam. So remember the PAMs, remember we watched the video. So Ativan is, there's two names, right? Generic and brand, sorry. So lorazepam. So that's benzo. And this is hysterical. She has to, sorry, I'm being mean. She has to calculate the formula. Do it in your head. Are you serious? Just watch.
Did you speak to the provider about Miss Simpson? Yes, he prescribed lorazepam and I'm calculating the dose now. Okay.
And I'm not knocking anyone that needs to do this on paper. So we go to the EMR, we go to medication administration. It tells us medications that she's on. She's taking birth control. She's taking Paxil, which is, as we mentioned, an SSRI, ibuprofen, all that good stuff, diphenhydramine, Benadryl. And what's been ordered right now, these are her PRN medications in the hospital. Lorazepam, which is Ativan, 2 milligrams, IM once now for anxiety. So 2 milligrams. So remember that. And then did anyone have, it was 4 milligrams per ml. So how much are we going to give? So 4 milligrams per ml, and we're giving 2 milligrams. How much?
8 milligrams.
Maybe I said it wrong. Don't give 8 milligrams. She'll knock out for like the whole day. And depending on her dependency of it. Did it say it here?
0.5 mils?
Yes, 0.5. Thank you. Did I say it wrong? I'm sorry.
Maybe I heard it wrong. My bad.
It's okay. That's why we're here. Do that now, and instead of being in the field, right? Why do we say that? On the unit. All right. 0.5, yay. And if 0.5 doesn't work, then we can, call the provider and say, can I get, 0.5 more? We always want to start slow because we don't know. I would ask for 2 milligrams for myself. Okay, now all of a sudden things have gotten much better. So now this is good and it's very short and then it's over. Now do you see she's sitting down? Why is she sitting now that the patient's relaxed, right? Anyway, I digress.
Miss Simpson, it's been 30 minutes since I gave you the lorazepam. May I ask you some questions about what brought you to the hospital this morning?
Okay.
Okay, so that's pretty much it and it's over. But that was beautifully done. So now that the patient's calm, everything that just happened, that was very well done. I'm just checking the chat to make sure. And 0.5. Excellent. Yes. Awesome. Thank you. Thank you. Thank you. Thank you. All right. So we're going to close this. Hi, Christy, you're on my screen. You just popped right up. So the last thing we're going to do, and then we're done. And I lied. We didn't get done early. Sorry. I didn't lie. I was mistaken. We can, these NCLEX questions, we can just run right through them. I would love to do them with you since I posted them and put the right answer. and there's only 2. And we've done everything except for, should we do the Quizlet review? Oh, nope, we're doing the Quizlet review. I want to do everything. Let's just do everything. Forget the meeting. Staying here. I'm kidding. I can't. I'm not going to keep you guys after, of course. Quizlet should be up. Where are you? Someone checked out. They're like, forget this. I brought Quizlet up. Okay, there's the movie. Close that. I'm working as fast as I can here. That's you guys. I don't need your Canvas. We could just do the whole review next week and all the Quizlet and then play Jeopardy if we want to do that. And then that's what it is. Okay, let's just do that. So we'll do the 2 questions real quick. It will not take much time. And I think that makes the most sense. All right, here we go. Maybe. All right. Put that up. Okay, you guys can see it. I'll just make it bigger. You can see the questions, right? All right.
Yeah.
So I'm not going to go as far into depth, but I do want to make this, I mean, we're here, we might as well make it worth it what it is. So this has nothing to do with medical, what are we in? Mental health. These are just questions that I always like to ask, having to do with teaching people how to answer questions. So the first one, it says the nurse cares for a child immediately. So remember, I always said, look at the time immediately. That's going to have a huge impact on this, how we answer this question. So the child immediately following a tonsillectomy. Where are your tonsils? They're near your airway. Okay, I think that might be important too. The nurse notices that the child is restless and agitated. For the most part, not always, but for the most part, when you see those words, and it might have to do with breathing, it's probably because they're having trouble breathing. When you hear that word, and it makes sense in the question. I would say like 95% of the time. Which action should the nurse take first? So what am I going to do first? Every single thing that we see on here, we're going to do. But what are we going to do first? Are we going to observe the throat, call the care provider, reposition the child, or check for vital signs? Who wants to be brave and say it? And you cannot talk if you've talked today. Not that I don't want to hear your voice. It has to be
Are you
someone.
going to observe the throat?
Who was that?
Philip.
Thank you, Phil. Exactly. You're going to observe the throat. Why?
Because we're just now checking the child and they just had like the tonsillectomy that's in the back of the throat. Could be something going on there.
Exactly. We're assessing. I mean, if we call the doctor or physician, they're gonna be like, what does the back of the throat look like? And we're gonna be like, I don't know. I didn't look. So we're always gonna assess first. That's nursing process. And normally in a normal situation, this is why I say don't take in things from clinical even that you've done. We would be doing all of this at the same time. There would be 2 nurses in the room, and we would be, I mean, the little blood pressure cuff would be on that little guy's arm already. We would start that. We'd sit the child up. We're already doing all of this at once. But if you could only do that one thing, I'm going to observe the throat. More than likely, what do you guys think is happening? Anyone can say it. Does it say constant swallowing? Yeah, and they're swallowing frequently. So just had a tonsillectomy, they're restless and they're swallowing frequently. What do you think is happening? And this is why the time matters. Immediately, not a week after surgery, not 2 weeks, immediately after surgery right here. What do you think they're—
Could they be bleeding?
Exactly. They're probably swallowing their blood. And I'm telling you that because I know it's in my head, but I have the rationales. You're absolutely right. So this little guy, unfortunately, is probably swallowing a lot of blood, but do I know that? Maybe they're choking on a cotton ball. I have no idea what's going on. I need to look in the throat. So yes. So I think we've got that down. Does anyone have any questions about that? So assess first. We always want to know what's going on. Observe the throat, but we will do all of these. Very good. Thank you, Phil. All right. The next one, of course, I love it's about the liver. So the nurse cares for a client 2 hours after a percutaneous liver biopsy. What is a percutaneous liver biopsy? I will tell you since we have 3 minutes left and I don't want to keep you over. It is basically where you take a nice long needle with a huge lumen at the end, and you are basically numbing the patient, sticking that into the patient's liver and taking cells out to do a tissue sample to be able to see what's going on with the liver. This happened 2 hours ago, which is not very long ago. So I'm still, going to watch for bleeding, especially. If you did not know this, the liver is responsible for your platelet counts. It has a lot to do with platelet counts and clotting, blood clotting. That's why a lot of people that did I spell that wrong? Biopsy. If I did, sorry. But keep in mind that the liver, it has over 500 functions and it has a lot to do with bleeding. So that's why somebody that might have a problem with alcohol, they bruise very easily. Their platelet counts are usually low. That's just kind of a side note. So which requires an immediate intervention by the nurse. So immediate, what do I need to do right now for this patient? So number one says a client is positioned. Oh, which one needs immediate intervention by the nurse? So are we looking for something right or for something wrong? Oh, wait. Yeah, we're looking for something right.
Wrong.
I know, I thought the same thing when I read it, and then I'm like, wait a minute, I've done this like 567 times. Which finding requires an immediate intervention by the nurse?
I guess.
So which one of these is going to be the most priority, I guess? So it's kind of like a priority-based question. So number one, the client is positioned slightly on the right side with a pillow under the head. So we're trying to prevent bleeding. What side of your body is your liver on?
The right side.
Yes, the right upper quadrant. So this is actually, they're trying to trick you. It's actually good. I know it sounds like, oh, why would you want to put them on that site? They didn't just have surgery, they had a biopsy, and it's actually helping to potentially put pressure so that bleeding doesn't happen. So that's actually good. Number two, the client reports aching, throbbing pain that goes up to the shoulder area. Many people pick this one for two reasons. Number one, because it is usually done laparoscopically. They'll have something to potentially, it depends on who's doing it and what type of procedure, but they think laparoscopic, and sometimes that air can travel. And the other one is the gallbladder. Do you guys remember, or have you learned about the gallbladder yet? If you have gallbladder issues, sometimes you have pain in your right shoulder area. So they're trying to confuse you. This is not it. This has nothing to do with either one of those. But even if you didn't know that, when we get to the right answer, you're gonna, I think, know why it's the right answer. So number three, the client states, I do not want to take the stool softener ordered for tonight. It's important to talk to them about it, but do you think that's priority right now? Probably not. So let's read the last one. The client states, my stomach feels tight and reports, and whenever you see this, increased abdominal pain. So something is increased. That's always something we want to look at. So where's the liver? It is in the abdominal cavity. This is where the surgery happened, and it was just done. What do we think is happening to this patient? Potentially. And it says, which thing are we going to do immediately? What are we going to do immediately? Like, which one of these is the most important? Internal bleeding. Exactly. So we're worried about internal bleeding because the stomach feels tight. And if the stomach feels tight, usually that means it's kind of bulging out, it's getting tight, the skin stretching. And I just mentioned that the liver has to do with blood clotting, right? So if you know that now, that would make sense. So that's why, even if you didn't know B and you're like, oh, I don't know. Even if that's let's just pretend that is a sign of that. Which one's more important? Your shoulder hurting or you internally bleeding? Internally bleeding, right? So even if you didn't know number two or number one, the most important one is this person's bleeding, it could bleed to death. So if you didn't know number one is the right answer or not, you're like, oh, I don't know if they should be on the right or left side. Number two, I'm not sure. Oh, shoot, is that the gallbladder or liver? I don't remember. Number three, fine if they don't want to poop, whatever, or feces, or defecate, that's fine. Number four is still going to win, right? Because that's life-threatening, safety. Do you guys agree? Oh my God, I can't wait to talk about ascites. Oh, don't get me started. ascites is it's a whole different thing. And don't get me started because we're already 2 minutes over, but remind me if you want me to talk about it. I'll tell you exactly what happens. It's very interesting. Oh, when we talk about addiction, I'll talk about it. I forgot what class we were in. I thought we were in medical terminology for a second. So any questions about that? I just put these up because I thought it would be nice to give tips and tricks. And we didn't have any of these this week. So they're up there. They're under resources. I'll post everything, make sure all the dates are changed. I'll have the Quizlet ready for schizophrenia, depression, and anxiety next week. We'll go over that, and then we'll do the Jeopardy, and that will be basically a nice review for your midterm. And then I will make sure the midterm is posted from the 18th at 8 a.m. to the 19th at 9 a.m. I trust your integrity. You're only cheating yourself if you cheat. I don't think you will. And email, text, or whatever you need if you need anything from me. I appreciate your time. You guys are my favorite. Oh, I said that on camera. Shoot. Hold on. Forgot to, let me stop sharing.